Hello, my name is Latricia Parks, and today I will be talking to you about cocaine addiction and the increased need to establish a chemical dependency program aimed at curing and helping cocaine drug abusers. In the United States, chemical dependency is at an all-time high. While many may be familiar with the use of marijuana, alcohol, and nicotine use, many are unfamiliar of the long-term effects associated with cocaine use. Did you know in the United States, adults aged 18 through 25 years old have a higher rate of cocaine use than any other age group? Did you know the withdrawal symptoms of cocaine are often masked in the form of psychological symptoms instead of physical? Do you want to help protect the future of our society by offering a program that will help those who are chemical dependent become free from addiction? If so, initiating a cocaine addiction program will help to serve citizens and result in major profits for the organization. What is cocaine, you may ask? Cocaine is considered an illegal substance in the United States. It speeds up adrenaline, causing the individual to experience increased levels of alertness, attention, and energy. It comes in a variety of forms, but the most common form is a fine white powder, which can also be formed into a crystal rock. Hence the reason many call it rock cocaine. Cocaine abusers either snort powder into their nostrils, rub it into their gums, or through a needle injection. The user experiences a brief moment of high, typically lasting about 15 to 30 minutes, which eventually comes down with a sense of depression and sadness. As abusers constantly strive for a feeling of high, he or she is more likely to result in an overdose, which could potentially be fatal. Here shows a display of dopamine in the brain of an individual who uses cocaine. The receptors love to increase the dopamine and allows it to accumulate, resulting in an intensity of the effect, which releases an excitability of happiness, arousal, leaves the person sensitive to light and also sensitive to noise, but ultimately results in the desired effect of being high. There are a total of 3 fast facts I would like to discuss in regards to cocaine use. Number 1, the incidence of cocaine use is more likely for females versus male drug seekers. Therefore, females are at an increased risk of using cocaine while being pregnant, thereby leaving the unborn child prone to being prematurely born and increases their risk for a low birth rate. Number 2, there is a clear connection between cocaine users and childhood trauma. Studies have shown that negative incidents, including sexual, emotional, and physical abuse, helps to add to the severity of use. Lastly, number 3, there is no antidote for cocaine. However, physicians normally prescribe anti-anxiety drugs to help stabilize the patient. However, it does nothing to free the individual from drug addiction. The risk of using cocaine include overdose, contraction of HIV, hepatitis C, heart disease, nosebleeds, and memory loss. 2 important bullet points I would like to talk about are overdose and memory loss. Individuals oftentimes overdose using cocaine due to the high feeling only lasting 15 to 30 minutes. Therefore, the individual has an increased need and persistent want to become high again. Therefore, they increase the dose needed to overcome their last previous dose, thereby increasing the chance of overdose and ending up ultimately in a situation that could cause death. On the right, you can see, spanning from 2001 to 2014, the amount of deaths that occur each year due to the overdose of cocaine. The last bullet point I would like to talk about is memory loss. Some individuals feel that using cocaine actually increases their alertness and attentiveness, thereby increasing their production and productivity in activities. However, long term use of cocaine will result in memory loss and making poor judgment decisions. Now we will discuss treatment facilities and the future of care for those who experiences drug addictions. Did you know hospitals also engage in in-house treatment programs? While many may offer these programs in conjunction with healthcare practices, they are less likely to offer assistance to those who are not currently experiencing withdrawal symptoms. Therefore, by establishing a chemical dependency program aimed at rectifying the behavior of cocaine abusers, you are allowing the individual to willingly seek help and helping the individual make it through withdrawal crisis to establish a new life. The lack of available resources for mental health and drug abusers are at an all-time low. While there are numerous hospitals to assist with everyday health issues, mental health and drug abuse has taken the back burner. There is an increased ability to cater to the needs of those around the age of 18 to 25 years. Due to this population being at an increased risk for cocaine use, due to society pressures, becoming New World adults, and experiencing life away from home, treatment facilities are needed to help establish a firm foundation and to get individuals back on the track that he or she should be. Not only are treatment facilities in the best interest of the consumer, such as drug abusers, but also in the best interest of the organization, as since mental health has limited facilities, increased revenue will also result in return. As an organization aiming to establish a chemical dependency program, one must consider the profound effects of a community filled with access to cocaine. As mental health and drug abuse programs are limited, the increase of abuse will continue to flourish if the organization does not take a stance against cocaine addiction. In addition, the young adulthood population will continue to turn towards a relief outlet that results in long-term consequences, including death. Establishing a cocaine addiction program will serve both the community and the self-interest of the organization. As individuals seek treatment and are referred from hospital-based practices, there will also be an increase in revenue. Individuals referred are often covered under health insurance known as the Mental Health Parity and Addiction Equity Act, which prohibits employers and insurance companies from discriminating against paying for needed healthcare services that will help assist in establishing a better lifestyle for the individual. As drug abusers receive treatment, the revenue of the organization will continue to increase. In addition, there may be a potential for forming a working relationship with hospitals whom do not have an in-house drug abuse treatment center. In closing, it is important to remember that in healthcare, we are doing the work of God. And as he states in 1 Corinthians 10 and 13, no temptation has overtaken you except what is common to mankind. And God is faithful. He will not let you be tempted beyond what you can bear. But when you are tempted, he will also provide a way out so that you can endure it. Establishing a chemical dependency program aimed at cocaine drug abuse lays the foundation for individuals who want a way out of that lifestyle. I encourage you to strongly think and strongly consider establishing a cocaine abuse program to help not only the community and not only yourself, but to also do the work of the Lord. Thank you.